Working on the front lines of the pandemic in 2020, Ilisa Nussbaum, a dietitian at Yale-New Haven Hospital, felt overwhelmed and paralyzed by fear. She struggled to find a local therapist who could help, until she discovered a mental health app through a Facebook ad. This app used a talk therapy chatbot to help her monitor her mood and cope with her feelings during the pandemic. Research has shown that the app was effective, with young adults experiencing a 20% reduction in depression symptoms after using it for 2 weeks. With the ongoing COVID-19 pandemic, stories like Nussbaum's are becoming more common, leading to a high demand for online therapy platforms and mental health apps to provide support for those experiencing symptoms of depression. In the age of anxiety and depression, it's becoming increasingly difficult to access in-person therapy. That's where online platforms come in. They offer convenience and affordability, and research shows that online cognitive behavior therapy can be just as effective as in-person therapy for treating anxiety and depression. During the COVID-19 pandemic, online therapy has become even more valuable, as it allows for face-to-face communication without the need for masks. However, experts are concerned about whether online therapy can provide enough support for those experiencing moderate to severe depression, as it may not be able to connect them with local resources in case of a mental health crisis. While online text therapy and automated apps may be helpful for those with mild depression or temporary stress, they are not a substitute for real, in-person therapy. They can be viewed as a temporary solution until access to traditional therapy is available. When considering an online therapy or mental health app, it's important to ask the following questions. Is the therapist licensed in your state? This ensures that the therapist has met the minimum level of training and is in good standing, providing you with protection to file a grievance if needed. Is the platform HIPAA compliant? All licensed therapists need to abide by patient confidentiality rules, whether therapy happens in person or online. Look for a privacy notice on their site that mentions the use of encrypted web-based platforms compatible with the Health Insurance Portability and Accountability Act. Is there research behind it? It's important to check whether the mental health app has any published research behind it or was developed by someone at a major university. Ultimately, online therapy and apps can be a part of your overall self-care routine. They can provide an opportunity to focus and cultivate mindfulness, helping to quiet a racing mind and encourage relaxation.